More than 1 million vaccines don land Naija to fight dis wahala wey dey spread across many states. The question be how e go reach everybody wey need am, especially those wey dey rural areas. To help us break am down dis story, I carry one man wey sabi health gist pass. Im na ogbonge person for dis matter. E no dey hide truth, e no dey do bend story. My correct people, help me welcome Jaafar Abubakar. Jaafar, welcome to our studio. How are you? Okay, on this health matter, first, clear ground for us. This mandatory health insurance wey government dey push for MDAs, wetin e mean in simple language?
Well, not be new thing. If person employ you for work, normally not be wetin dem dey call salary, not be just salary. E dey get many things for inside. Housing dey inside, transport dey inside. Some offices dey provide clothing allowance. Some dey provide many things shall follow for inside wetin dem dey call salary. So not be just, say when people go hear salary, they go to say na one money. Now many things now they join together wey lead to salary. And normally health insurance now one of those things where they always follow dey inside salary. In fact, e join part of the thing where government puts where they write for inside our law say your employer supposed provide a percentage of the money whether they pay you for work where they do as health insurance. So if it be say now this one way government one they push for these things, now something we don't do before. But if it be say many of those MDAs and MDAs now ministries, departments and agencies,
Yes.
many of them they're not taken serious. Because like a lot of things that we do for this country where we say it did law, but we not they taken serious.
Okay.
So if you be say many of them not they taken serious and government don't decide say okay, people where they work for us, people where they work for us, where we they pay salary, we suppose get accurate number of waiting their salary be in terms of if this one are for housing, this one are for this one, this one are for this one. And the one will be for health insurance. We go make sure say them use them for the health insurance.
Okay, when you say people not take am serious, which people not take am serious? Now the government, I mean the workers or the people who employ them. Like you talked before, say for inside salary, if you want check them, they cut them down for employment letter or something to say this one are housing, this one are this, and this one are for food, and this one are wardrobe, and this one are for health. So people whenever they practice, and it means say that they already they come out for their salaries. Now they know they practice them, now the people where employ them. Now not make them available. Say okay, we don't they cut our money or go and register for these things. Make they remit money to them.
So most times the thing is say it depends on how the office they be. So many offices, especially for we the private sector, if we join new office, it gets many forms where we dey fill. In fact, they will come tell you say okay, now this health insurance we dey use where then they call HMO. Now we dey use, then go tell you say okay, where you they stay, then go give you lists of hospital where near you, say make you go register, say now this hospital we dey use. And so all those things, if follow for waiting that they pay you, and at the end of the month, they go deduct them, they go they pay the HMO. So I no can know how they do them for government them, for the ministries and the department and agencies. So normally it's supposed to follow this procedure. We be say then go say okay, you would they work for maybe Ministry of Finance, or you would they work for Border Control Development Agency, or you would they work for Department of Port Health or under Ministry of Health. Now here you suppose they, and here you suppose they. So sometimes if you be say the people where them employ, them know, say many things that we they do. Sometimes we go just look the letter, we go just say okay, now the money now concern me. We not they read the contents finish. So if you say me where they employ, I no ask. Or if you be say the people who employ me were supposed to give me this orientation, they not give me. So some of these things that go they come out for money, and people not go people no know what they go just accept say okay, now normal deduction where
Now
then
this one they
supposed
pay
come
me,
out.
now this one
Now this one that they pay me, now this one that they
not
deduct.
knowing say hospital
They're
money they
supposed to
inside.
use them exactly.
So can't hold account. There's so money
Exactly.
that they because
That they
it's not
deduct
no.
exactly.
This insurance, how you go take benefit workers for MDAs and even ordinary Nigerians who know they work for government?
So the thing with health insurance is say e get how e dey be where e dey help you wey be worker, or make I first start with people wey be worker. So e fit be okay, make I even look say my salary now na 10,000, and for inside that 10,000 dey comot 2,000 for health insurance monthly, and every month. So if we say monthly in a year, that means na 2,000 times 12 months, so na 24,000 na
Okay.
im that month go be. And under health insurance, e get wetin insurance dey cover like that. So normally, if I go hospital now, say be sick, hospital go get many things wey dem wan do to know. First, they go first do investigation to know whether I truly dey sick. Then they go wan know the type of sickness when I dey sick. Then they go wan know how dem go fit take treat that sickness. Then they go wan know the kind medicine wey they go carry give me. If I no get insurance now, all these things I fit go hospital. Hospital go tell me say everything, my money na 70,000, and that one na one time. But because say I get insurance and my insurance dey cover me, I fit go hospital. All that thing now, maybe if I too pay, I no pay reach 10,000. Now the where the thing can't take the work, be say not be every day you dey sick. So sometimes some people dey wey be say since they start to dey pay, since they start to dey work, whether they comot money for their insurance, they're not dey sick. So the thing just dey there. But it go just be like when you dey put money for inside bank, you dey keep money for bank. The day we not dey pray for sickness, God forbid sickness, but the day wey person body not too dey okay, if you waka go the hospital, they tell am say make you do this one, do this one. When you do everything finish, you go come show them say I get insurance. Insurance will clear everything for.
But even with this health insurance, we know say the way this thing dey work, if you check some hospitals where bring say okay, when I come under our health insurance, blah blah blah, the workers go tell you, the person wey employ you go let you know say for per month, na for health, na so 70,000 naira you suppose consume for health. And you don talk am now say that insurance not be every day person dey sick, not be every month person dey sick. Na e be like bank where you dey put money, so when you come sick, everything they will take and treat you and like that, like that, like that. But this one na I no sick for 4 months. Then the 5th month I come sick, and then tell me, then e don dey there say na 70,000 naira na im be my health insurance for the month. I no go use pass that one. If I use pass that one, na my pocket go come. And I come go sick where e be say na 170,000. And you see say for that 4 months now, my money don accumulate. But now I'm only eligible to that 70,000 because na that month na I sick. So who go come pay the remaining one wey be say my money don dey backward already? Now out of 170,000, na only 70,000 now I fit chop, now I fit use take cure myself. The remaining 100 na me go pay am. How you see that matter?
So the thing be say insurance not be one, not be solution to everything. Insurance dey to cover you, but it just be like person wey dey sleep, we wan sleep for night. E can't carry wrapper, use am cover body. Say cover body no mean say cold no go catch am, but e just mean say the cold wey go catch am compared to person wey no cover body, im own cold go dey very reduced compared to person wey no cover body at all. And they get different stages of insurance, different levels. E just be like who dey drive motor. Person wey dey drive Golf 3 and person wey dey drive Jeep, they no go use the same amount of fuel, even though both of them dey use fuel. So person wey dem dey comot 2,000 for im money for insurance, and person wey dem dey comot 70,000 for im money for insurance, dem no go dey use the same type of insurance. And the thing be say, before you start, insurance people go tell you say, na this kind thing na im be this, na this kind thing we fit cover. Now this kind thing we fit do. So sometimes people they use them in such a way they will say, okay, as it be so now, uh, we want make insurance cover drugs for us, because if you say we go use our money for pocket, go buy the drug, it go dey very cost for us. To make insurance cover the drugs, we go use our money cover the rest. Because even if we say make we look am, this as you take talk say na 170,000, they say make person pay, insurance cover 70,000. What if the person not dey insurance and his salary na 100,000? Where you want see the remaining money take pay for the rest? So insurance na cover, but not be
Not
say
be full cover.
exactly, not be say e go cover you finish. You sef you go still get some kind responsibility for inside, but e no go cover you finish, but e go cover you small.
Because okay, like you talk, Sha, insurance dey different. Because I get person where be say e dey work, better work. But so out of 70,000 where hospital give am, she say I get insurance and na my HMO. And the doctor let am know say 70,000. Na only 3,000 naira na your money cover inside. So the remaining one, wetin you call that kind of insurance?
So the thing now be say, e get wetin I talk when we start the yarn. Say we not dey look paper, we not dey look paper finish. So sometimes, and this one now na wetin our regulatory body them, na wetin they suppose do. Sometimes now I feel they work for place wey be say I dey collect 500,000 as total package. They say na total package 500,000. But because say I no look wetin dey inside my offer letter, if you be say the company now don't go register everybody for the company for one HMO wey be say na one amount that they collect, but now this amount those people say they will pay in a month. So imagine person where they collect 500,000 and way they say they can't tell and say your HMO now only 3.5 they go pay in a month. The first thing where I go fair do be say I go fair ask question. Una not fit tell me say my money na 500,000, then na 3.5 HMO una go register me put. Where the remaining money where una say una want collect, where the remaining money they go? We go fair ask that question, because you know so as good people dey na so bad people dey, and they're there everywhere, whether na for house o, na for office o, na for where we dey worship o, whether na road o, whether na. So sometimes some people they use all this kind of thing they do mago mago. So they go chook hand for inside the this thing, go chook hand for inside another place. You go come they look say I get insurance. Now they go come tell you say yes, Oga, truly you get insurance, but waiting your insurance, waiting your people talk say make we cover, not be waiting you to say you fit cover. So many of those things sometimes too, when people register for insurance, they're not they look finish. It just gets some insurance now. It get this one where people they commonly make mistake. Say insurance they cover to born pikin for hospital. Not be every insurance they cover to born. So person, some people go think say I get insurance, so I fit go hospital go born. But they no look the paper when they give them. They no look the kind things where the insurance they cover, the one where the insurance no they cover. So when the time can't reach, they go come talk. But I get insurance now. Why would not they? So now some of these things, when person tell you say, or when office tell you say, or when even yourself, when you say, okay, I want to register for insurance, you go first look the kind things where the insurance, waiting them they cover, how them take the cover them. Because some people now, some insurance, they go tell you say, okay, we they cover 3 surgery. What if they no go tell you be say, the 3 surgery where they cover, they cover those 3 surgeries for every quarter of the year. So you know if you do pass 1 surgery every 3 months. But for your mind now, you don't believe say I get insurance where they cover 3 surgery and you need 3 surgery for 1 month. They go can't tell you say no, we not the cover them like that. Okay. So sometimes when we they look at this insurance thing, it is very important. Say we also look the paper, we look the fine print, we know what's in their rights, we know how them take right now, we know how them take the come out our money, and we know what's in our money they do before we carry head shoot for inside the thing.
That one makes sense a lot. And so you where they listen, don't hear my guest say, if they give you letter of appointment, may you try go through and well. I know say if they give you letter say you know fit read, look for person where sabi read, look for lawyer and anybody where go fit explain am to you. May they tell you whether HMO dey, and if the HMO dey, make they tell you wetin the HMO cover. Not be say you go hospital tomorrow, come talk say na useless HMO wey they give you, that hospital don job you, don take your money. Na only 3,000 and now your HMO cost, na useless HMO. So you when they listen, when they come back, we'll take would like to go for one short break. Stay tuned. Welcome back. And I tell you before, say inside Christ said, your matter now we own. And Christ said they bring big, big things this ember month, make you know miss Sam. Try listen. Listen live or follow us for all our social media at CHRICED Radio TV. Make you for not miss this ember month giveaway. I promise you, you no go regret them. So we sit there on top our Kajad Body For All inside our afternoon wakayan, and to follow us live at www.CHRICEDradioandtv.com and follow all our social media platforms at CHRICED Radio TV. So the topic we dey on today now say insurance, health insurance for all MDAs, and again meningitis outbreak for Naija. Say the vaccine they don't bring and come. So we still get our guest for studio. His name is Jaafar Abubakar. We still get series of questions. So we ask Jaafar. So Jaafar, somebody say he don't already dey inside NHIS the endurance. So how this new policy will take affect am?
First and foremost, make we first talk am. Before na NHIS then they call am, but we hear say them don't do rearrangement for their law, so them can be NHIA. Say them be Nigerian Health Insurance Authority.
Authority. What did
Yeah,
that
say
S stand for?
they be before this be service, but now
Okay.
they be authority.
Authority.
Say na them be regulator for anything health insurance matter. But we still get the health insurance, the national health insurance scheme. So na the thing where we been dey talk before, say some people dey, them don't register, them don't already do all these things, but them no know anything whether it cover them, no cover them. Normally, this new thing are not supposed to affect them. It go just be say who not know before who can't sabi. Who sabi now who can't know how you go take use them. So before now, if you say they say, oh, you dey NHIS, say they deduct money, you dey pay NHIS, you dey undercover for NHIS, but you not know where you go. Now, when we say they don't make a mandatory, a mandatory we say by force,
No get
by fire,
choice.
not get choice. Everybody must it just be like NYC. So everybody must do them. So you go come know now be say you go come go your office. If na HRO, if na admin o, if na the department, waiting that they call them for that office, you go come know to go ask them, say, Oga, this thing for health insurance, how we go take wakaram? How we want do, where be my place? I don't register, I don't give me this thing, I don't get all this thing. So whether not to go, I go hospital within my area, go find one register, say na my hospital be this, and NHIS go they pay, or then go give me card. Any hospital when I go, when they treat me finish, if they ask for money, I go give them my NHIS card. NHIS go do how they go take do am. So now where they don't make a mandatory, it go come dey on top the workers then, where they work for this relevant MDAs then. You can't know who to go ask question and the kind question to take ask, because for all this kind thing, I no know, I no sabi, e no follow. Because you wey dey work, na im dey pay for am. Make the thing no come be say monkey dey work, dey pay money, baboon sit down for one place, dey collect
chop am.
money. E go just dey chop am, dey part. So person wey dey work suppose fit still see some kind benefits for where e dey work. And na one of the benefits for where person dey work na im be this health insurance. So now the thing don dey on them now wey be workers to know who they go ask question, to know the kind question wey they go ask, and to know how to take follow up to enjoy this thing wey be their own.
You don talk say this compulsory insurance fit reduce out of pocket spending when person fall sick.
Yes.
So wetin be the wahala wey fit stop this insurance from working? Wetin you think say e fit stop this insurance from working?
Na the same thing wey dey stop many things to work for Naija. Na oyinbo dey call am incompetence. If people no incompetence, then laziness. You know say me and you as we sit down so, we be Nigerians plus our people wey dey follow us, dey watch for house. Make we no lie, make we no thief. We go look am say sometimes I get some kind things wey be say once we look say, hey, I go carry this paper, go this office, go this office, go this office. Abeg, I no dey do again.
I just go pay the money for hospital.
Exactly. How much be the money sef? Abeg, I no dey do again. That one e dey follow us well well. We dey call am fatigue, and e dey very common among Nigerians. But the thing be say if we follow all these things, we follow and reach the end, now we go still enjoy am.
But you dey talk on the part of the workers on
Yes,
the patients. What
I
of
go
okay?
reach that. So I start with our own because now who wear shoe, na know where the shoe dey pain am. So and na person wey dey work, because na me dey work for the salary, na me dey work for the insurance matter, na me dey work for person, na me know the kind money when I dey work for, when I suppose dey enjoy in terms of insurance. So all the waka, person no fit talk say, hey, abeg go, I don tire, I no do the waka, make you for take enjoy the benefits wey be your own. Then the second part now, na the incompetence on the side of the
and sorry,
manager.
that waka you want waka now. Every time when you sick, they waka that waka. Now just once
No,
registration.
now once you do all the registration, you don't know the hospital where you dey go.
Okay.
You don't know your provider. You don't know everything. You don't finish shikena. All you go just make sure say you dey do be say, and that one supposed to be automatic. You dey pay your contribution towards the health insurance. So as the money they come out for your account, they reach your health insurance provider. Shikena. All you just need to do be say, I dey sick, or you don't even need to sick, because some health insurance that they give things like gym. Say person go gym. So
yes, I know organization where they give and they say all their workers they provide gym for office. You must do gym before you climb.
This one not be even organization where they provide gym. And they talk about health insurance. Some health insurance companies, as part of the packages.
So some health insurance companies, some they cover gym.
Yes.
Not just hospital.
Not just hospital. They cover gym.
Okay.
Not even gym, so they cover spa. Yes. So depending on the kind of package where person get, because you know say health generally not be just hospital matter.
It's not a better thing, no.
Sometimes make person chop belle full na still health. Because if person be hungry, you know go dey think straight. So if you see food, you chop belle full, na health. If they waka, you don't see now me as I be like this, na I part. Say I see health insurance will give me gym when I dey go every day. I go gym, na part of health. So I don't tire. See my head now, my head dey red. Make I go spa, make they put this thing where they put for people face where it dey white, where they will come be like Ojuju Calabar.
Then they call am spa now. Spa treatment.
They'll do all those things. Person go put hand under this thing, they go do all those ones. It still follow for health. So some health insurance that they offer all those things. So it go beyond hospital. So all these benefits now some people they live, they don't know whether they enjoy. So the other part when I come they talk now the incompetence on the side of the administrators. Because we know how it may be sometimes. You go some kind of office, especially our government office, them. You the follow person talk, you go they look you like say this person they disturb me.
Now they come like so now the job where they put you, do the job.
Work where they put you, when you they collect money for at the end of the month.
You not stand there, they break melon, they do.
You
go
say,
this way.
I beg you, they disturb my talk.
Actually, if you look that waka, na make we sef go tire to waka that waka, be like government office, they no go answer you.
But me, I know the tired to waka benefit will be my own. If I know say something on my own, and legally, not be say I beg person, say, Oga, I beg, madam, I beg. I mean, legally, now waiting I suppose get be this. If you tell me make I waka from here, go Sokoto, from Sokoto, make I go Port Harcourt, from Port Harcourt, go Lagos, I go wear my shoe, put my socks, carry my kaya put for head, I go do the waka.
Because now once
now
waka,
my own. Once I do and finish, I don't do and finish. Anything where they come, now my own. I not fit they work, make I they pay. It just be like me person carry basket, go river, go they use the basket to fetch water.
my people, you don't hear am so. The one wey sees me pass for inside, we say insurance dey cover gym and e dey cover spa. So make I look for the one wey go cover spa for me, make I go do small small things on my nails and put all those many things on my face. So on the issue of meningitis outbreak and the vaccine, we know say meningitis no be small sickness. Abeg, Oga Jaafar, wetin cause this outbreak wey dey shake plenty states now?
So the thing be say meningitis na disease where they come as via bacteria or virus or fungi. Now they cause this
When you
meningitis.
say bacteria, viral, fungus, na something wey dey on air, na airborne.
So bacteria they airborne. Sometimes it dey inside people body. As me and you sit down, so we get bacteria inside our body.
Of course.
We get bacteria on top our body. Yes, because this our skin self na organ. And as it be organ, so bacteria dey. They go say person get good bacteria, get bad bacteria. The same thing, bacteria dey our belly, where they help with digestion and everything. They go say good bacteria, bad bacteria. We still get bacteria for air. We get bacteria for plant and everything. As me and you take it down, so we be living things. Bacteria self na living things. And fungus or fungi as the plural be, na so themselves be. But many of these things, they cause plenty sickness. Like for instance, now the bacteria wey dey cause malaria, na mosquito dey carry am. They call am plasmodium.
Okay.
The one
I
wey
don
dey
hear that name
cause
before.
typhoid, they call am typhus. E get the one wey still dey cause sore throat, call am streptococcus. Then we dey hear of the other ones like syphilis, chlamydia, all these ones na still bacteria. So meningitis na one kind bacteria na im dey cause meningitis. They call am meningococcus, and e dey our side. You know, say Nigerians we dey one place where experts they call Africa meningitis belt, especially the states where they for north. As we dey Abuja now, then people where they Kano, where they Sokoto, they Maiduguri, all of us from that side, even reach people where they Niger, people where they Burkina Faso, then people where they Chad, people where they Sudan, we dey the meningitis belt, because that area na area where we say when rain no dey fall, it dey hot. And not be just say it dey hot, it dry. You dey see as it dey be for heat period, where we say it go be like say make person nearly may head come off for him body. You not even wear clothes, it go be like say make you come out your skin for your body, make you put your skeleton for outside. The heat go dey do you. So now where we dey. So now the environmental factors where they cause meningitis.
Okay, so heat
be
dey
that.
cause
Heat na one of the major environmental factors where they cause this meningitis. And another one we see they cause am be say this one now we not to the reason I'm like that. Now people, you know, as we did talk earlier, say bacteria dey everywhere. People they carry this bacteria for body. This bacteria where they cause meningitis. Then they carry them for body, but they don't know, and you know they affect them.
So this meningitis, they feel they transfer am from one person to the other.
If I carry meningitis like this now, then maybe I did now I cough. As I cough now, small droplets go follow my mouth. Come on. Then as you dey talk now, you don't enter your body. Now e enter your body, no mean say you go carry meningitis in your body. Some other things gas dey before the thing will come to sickness for your body. It just be like person who want cook jollof now. We say You don't put rice, you don't put tomato, you don't put maggi, you don't put raw chicken, you don't put spices. You just pack everything, put for the pot. You dey expect say jollof rice go form. You not wash the rice, you not blend tomato, you not spice, you not do the spice, you not do the whole process. Wey be say jollof go form. You just pack everything, put for there, say expect say jollof go form. Jollof no come like that. So now so meningitis dey. If it dey person body. But if the right combination of maybe weather no hot, then the person immune system no, kajad, then there may be some other one or two still follow, the meningitis no fit form sickness. That's the meningococcus, wey be the bacteria no form sickness for the person body wey go come turn to meningitis. Because that meningitis, the name meningitis, itis na inflammation, wetin dem dey call say something something swell, something dey burn for inside body, inflammation. Meninges na here e dey, na part of the brain, na this side e dey. So meningitis basically na inflammation of the meninges.
Okay.
So meningitis, and this bacteria wey dey cause am now, if everywhere don flenjo, or everything don dey alright, e come enter body, e go come go the meninges, e go come inflame the meninges. E come be like say
Even meningitis say dey flenjo inside person body.
na so the thing be na. E just be like when Aboki arrange this thing, arrange suya, want do suya, the meningococcus will come go the person brain. You can't use the meninges, you can't use and arrange suya, you can't cause problem.
Oh wow.
So now wetin dey cause am be that, and where we come dey for the meningitis, we dey very right area for all this kind thing to happen, and we not come dey take public health advisory, we not dey take am serious. Like for instance, now we still dey this place, now we dey stay house wey no get window. Even for the house wey no get window, now we dey stay like 17 for inside the house. Then for inside hot weather, now we not dey drink water. For inside hot weather, now we go still wear clothes, like wrap body like
No, like they talk and say hydrate, drink water,
drink water. When the weather is hot, wear loose fitting clothes, make breeze fit blow.
And this drink water not be only for meningitis, even good for body. Make person no go faint.
When they go talk say, they go tell person say make you drink water, go say whether water go hold in belly. Any small thing wey dey find wetin go hold belly.
Go belly, water dey stay for belly. So for this thing, I don't talk of wetin dey cause this meningitis. Say we dey live for houses where be say ventilation no dey, and our weather hot so much, and again we no dey hydrate. Make we try make we dey hydrate, and make we try make we dey wear loose clothes during hot weather. So Oga Jaafar, government don bring 1 million vaccines come out. So how you think say they fit share am easily, especially make it get to those people wey dey rural areas?
So the thing with meningitis vaccine be say not be for adults, not be for pikin, na for baby. Because if you look the vaccine, we dey call them vaccine schedules, na the vaccine where we dey give children them when we born pikin till when pikin reach age of 5. E get the vaccines where we dey give them, the way that they take. So we dey give pikin BCG, OPT1 at birth, like that. We dey give meningitis vaccine at 9 months. And one thing where I want correct be say many people think say vaccine na cure. Vaccine no be cure. Vaccine na prevention. So vaccine,
that prevention, you mean say okay, vaccine no be cure, na prevention. Mean person no go get this thing.
No, not be say person no go get am. But if you get am, it no go affect you
the way we say
it go dey affect person wey no take the vaccine. So wetin vaccine dey do be say vaccine na be like alarm. Thief dey come area, thief don enter this person house, they don gbege the person things. They don enter the next person house, they don gbege him things. The third person house, now they wan come enter the third person house, they come mash something for ground. Thief. E no still mean say the thief, so na two things. If the thief them, if they no kajad, they go waste. But if they kajad, they carry, they go enter. But because say my alarm don already tell me say thief dey
Expect.
come o, thief dey, me sef I don gallant, I
Mm.
don wait them. So if na wetin dem wan carry, wetin dem wan see carry, I don clear everything for ground. If na you shoot me, I shoot you, na we wan do, me sef I don dey ground, I don stand. So na wetin vaccine dey do for body be that. Vaccine go tell immune system say, see this thing when I carry you, e fit enter your body.
Mm.
If e enter your body, you go come remember say, don first me and this thing don first kwanta before now, don first gbege am.
Don't get
So
experience.
as you dey see the thing dey come now, your immune system go come set say, Obafa, any idea, I'll follow your eye. O." So even if you give me like 2 punch, I'll give you 5. So now wetin your immune system go come do? Say your immune system go kajad, then with drugs wey go come follow, the way wey meningitis suppose dey affect person, e no go come affect who don dey vaccinated like that.
Okay.
But vaccine no be cure.
But you talk say this vaccine are for children, for babies wey they just born under 9 months and
Yes,
below.
meningitis na 9 months we dey give babies.
Okay, you mean say meningitis not fit catch adults?
Fikash, na wetin I dey
So
talk be
adults
this.
wey not take meningitis vaccine during baby, they not fit take am as adults.
No,
They
e
not
no
fit take
go
am as adults.
dey effective
Okay.
for adults again, because wetin a lot of these vaccines and for a lot of these diseases, wetin we dey do, wetin we dey use and take do be say, we dey want make children grow
Grow with them.
with am, so their immune system go recognize am. So even if na 10 years later the thing come, immune system know say yes, this thing we don first see am before. So adult wey no, and the thing be say, pikin immune system and adult immune system, 2 different things. E get how headache, malaria go hold pikin wey be say e go weigh the pikin down. But me and you now, e get how malaria go hold us, wey be say na to just sit down, drink paracetamol, then the headache go waka go. Then we go say, okay, make we quickly do 1 or 2 before we go hospital, go do the necessary investigation, make dem confirm say na malaria before they do the treatment. So na so the thing be for that side. So now why we dey give children, now why we dey always emphasize say immunization dey very, very important for children. And e get wetin you been talk as you been dey talk the thing earlier, say how the thing go take reach people wey
For
dey
rural areas.
rural, wey dey village dem and everything. And that one na one place where, as always, I go always dey give 2 hands to our health people dem, especially people wey we dey call CHU, community health extension workers, wey dey waka. I know say even when you small, you dey see them that time when
True.
they dey waka
They come my
from
school,
house to
come my
house,
house.
they go school, they go village, and not be say that they speak English. Now the language of the people, them, now in that they speak, they go tell the people say, now wetin we carry come be this, now wetin we dey do be this. If you get pikin we no get this thing, carry am come outside, may we give am this thing so that im body go better. A lot of this our people them, they do very, very good work. They waka go places where we say even people not think say people dey inside that place, they go all those places. So the thing what we fit do not to encourage them, because we know how the state of the country be, country not too balanced like that, and it can't be like say not too safe. So not to encourage them, where we fit give them better means of transportation, instead of them that they use their leg, they waka from this place. Maybe we give them motor, or if motor not fit enter, we give them machine not fit reach there, we give them keke, or bad as bad, we still give them bicycle. Then we still make sure say these people that they do better work. So we make sure say we go give them better money, whether they collect better money. Then we'll still make sure say we give them better materials when we they go take use take work.
And government don't try for one heart to say, even those where people say, okay, if you see foreigners for your community, so they carry syringe come, you go dey fear. But government they make sure say now people of that community, now they use to say, okay, now my person be this, no fit do me bad. Oh, this person to come and with this syringe say, now be say it could truly work for me. And again, some people they fear vaccine. We talk about vaccine and we talk about injection. Some people they fear vaccine. Why some dey fear to be injected? Some say they fear the vaccine and the injection they fear. Then some wey dey fear the vaccine dey yarn say e get side effect, e get this, e get that. When you talk about the COVID vaccine, they say na to eliminate people, say people too much for the country. So government don plan with white people to say they eliminate some people. You dey hear this kind myth, abi? So how you go take calm mind of these people and advise them say this vaccine make dem collect am?
So you see this thing, it dey always make me laugh because when people talk say they wan use vaccine take kill people, say government wan kill people, Oyinbo wan kill people. And I dey always tell people say if Oyinbo wan kpai people, Oyinbo no need to carry vaccine come give una say una we dey chop biscuit, abi we no dey chop biscuit.
I
The
think they wan go
biscuit,
to atomic bomb, just drop am.
no, they don't even need to drop bomb. The biscuits, how many we dey chop?
They do for here.
We dey chop chicken, abi we no dey chop chicken?
Chocolates.
We dey chop chocolate, we dey chop all these things we dey chop. We dey wear clothes. See, if Oyinbo them they say they want, say they no need us, they get many other things to do, not be vaccine. They go take comot person. And people wey dey talk say vaccine get this one, but if you check many of them, they collect vaccine. No, many of those people wey dey talk say, I no go give my pikin vaccine, this one, that one. Check the person wey dey talk am. Im papa and im mama make sure say all im vaccination from 0 to 6 years, everything complete. They say I too know book, na im make tortoise loss. When people come begin dey read wetin no concern them. The come think say they no book pass who go school go learn that thing. They go come tell you say, oh, I no dey collect vaccine, but I go drink this water with this water with. Who tell you say that water dey work? Who tell you say vaccine no dey work? And the last thing when I dey always use, if I don't follow people talk all this one, they no dey hear. The last one I dey always use, na 3 things I dey always tell them. Say Black Death, smallpox, polio. These na diseases where we say Black Death kill like almost half of Europe during the Middle Ages. Today now, na disease where we say it not even they exist again. Smallpox now still something where our papa them where they still get, where we say people still they get smallpox as at the late 1800s, early 1900s. Now today now smallpox now not be waiting that they talk about again because vaccination now
don't be everywhere.
Then polio, we don't reduce polio to waiting. We not even they talk. If people they talk about disease, exactly they take before they go remember say, oh, polio. Vaccination now I not go sit down for here talk say some vaccines not get side effect. Even medicine where we dey take say it gets side effect. But the thing be say many of these vaccines we don't test them, we don't do exhaustive testing. So before we can't carry and say we want give general public, we don't already make sure say it is safe. Then the relevant government agencies, NAFDAC or Ministry of Health, themselves they don't do their own test to make sure say it is safe.
True. So looking forward into the future, how Nigerians will prevent another big outbreak of meningitis?
So as always, join wetin I talked before. Say we will take our health measures, we will take them seriously. We go dey drink water, wetin you go to say we go hydrate. Then when weather hot, we go make sure say we do a lot of sensitization for our people them. Weather hot, make una not pack una self like sardine from inside room, say una dey sleep. If it dey possible,
and we'll tell our drivers all those ones too.
Yes,
when they pack people like sardine
for inside place. There even people for market. Everybody go dey market. Everybody go run enter market. Like say another thing dey for the market. Will not be the small things where we dey go buy. Then we go tell our people say when weather hot, make we dey drink water. make we dey wear cloth wey be say go let breeze,
Please
even though
enter
breeze
body.
not too dey, breeze enter body. Then as much as possible, make we try dey baff when the weather hot. If we see where we see chance, dey baff for morning, baff for afternoon, baff for night, so that we go fit cool the temperature of body down. Then we'll come make sure say as much as possible we dey chop well. We dey chop well, we dey exercise,
Vitamins,
we dey do
especially.
our vitamins, we dey take fruits, so that our immune system e
They
go
busy.
e go dey busy. Then our newborn children, our children, we will make sure say them take their vaccines as at when due, so that themselves then go fit build immunity against the disease.
Okay, between insurance and vaccine, which one you feel say you go fit advise government make they take seriously?
As I no go talk say make government take one serious pass the
Pass the
other one.
other.
The thing be say na something wey we need,
Mm.
because if I born pikin today, na I go want make my pikin get all the necessary vaccines. Then I go also want get insurance so that it go help my pocket. Say I go fit get money to take care of my pikin and take care of myself. So I no go say make government take one, make they drop one, but make they take the two, make they focus attention, make they do uh, better for we Nigerians.
So finally, what will be your advice to Nigerians so they listen both on health, insurance, and meningitis vaccine?
As always, our fellow Nigerians, we not say things hard, things not too day, but make we try, make we dey chop well. Uh, uh, vegetable no vegetable na something we suppose dey chop almost every day. Then once in a while we go still chop fruits, orange day, watermelon day, pineapple day. Then make we always make sure say we dey drink water. Make we dey try dey drink water well, dey drink water, dey drink water. Then if we dey work
Hmm.
for place where they pay us salary, where then they pay salary, make we try meet our oga them for where we dey work, make we ask them if them fee help us register health insurance, so that when they help us register health insurance, so that even if na small they go dey comot am for inside the money, if they not get provision for health insurance before, make them help us register, so that we sef we go fit dey enjoy some of these things, so that all those small disease, small, hey, I get malaria, something cut me for leg, headache, they worry me, where person they spend two naira, five naira, where they turn 1,000, we go fit use insurance, we go fit take use and reduce all those expenses.
Thank you very much. My people, you don't hear them. Health matter, no be play. Insurance, they save pockets. Vaccine, they save life. If you want to add your voice, remember saying at CHRICED Radio and Television Day. Follow us live for www.cricedradiotv.com and follow us for all social media platforms at CHRICED Radio TV. And yes, so like I tell you before, Christ said, don't bring you big things. You get a lot of goodies to win this Ember month if you fit answer the questions of the day. So today's question I say, who be the anchor of Know Your Rights for CHRICED Radio and Television? Who be the anchor of Know Your Rights for CHRICED Radio and Television? Drop your answer for comment section under this video. If na live you dey watch us, drop your answer, and anywhere at all you dey watch this video, subscribe, like, and share. Drop your email address or phone number with your answer under this video for your big win. You snoop, you lose, go carry last. So now here we go draw the curtain for today's story, but before we go, make we recap all the things wey we don yarn on top this topic. We say mandatory health insurance for MDAs mean say government workers no go dey stranded with sickness when sickness knock. If dem implement am well, e fit even ex ten d to ordinary Nigerians. The meningitis outbreak dey serious, but over 1 million vaccines don land. The main work na how e go reach everybody, especially children and vulnerable ones in rural communities. And you don hear my guest say, to reduce this meningitis outbreak, make you drink water, especially you wey dey work for airports, where sun dey shine, where dey work for inside market, where dey work for road. Make sure say you take break small to drink water and wear light clothes. If e be say na uniform you dey wear, If you get where you feel rest off your clothes, and when you go back to resume your work, make you wear your clothes back. And finally, insurance go help your pocket, vaccine go help your body. So make we dey wise. Big thank you to our guest, Jaafar Abubakar. We don't break down this matter. We don't break down this matter for us like correct teacher, and to you wey dey listen. Thank you for keeping your ear with CHRICED Radio and television. Till we jam again for another edition of Kajad Body For All, I still be your health gist partner, Falilat Adamu. Make you remember, say, better body na better life. Thank you. Bye for now.